Access to healthcare is a basic human right enshrined in the Constitution. But Stellenbosch University's Renata Schoeman says people must take personal responsibility for their health. This has been highlighted by the COVID-19 pandemic, where people have to ensure personal hygiene. Schoeman says free healthcare, as proposed by the NHI, will not help if people make poor lifestyle choices. Let's discuss this further now with Professor Schoeman, joining us via Skype from Cape Town. Prof, a very good morning and thanks for your time. So give us more detail on what COVID-19 and our response to the pandemic has highlighted for you in terms of our right to health and what healthcare, where healthcare, the right to healthcare falls within that.
I think what Classical demonstrated is, even on my walk this morning during the allowed hours, is not even 50% of the people are wearing their masks. So the government can do anything in their capabilities. Public and private sector can join hands in providing the best medical care, the best access to care for everyone. But still, if people do not take responsibility, you're not going to be healthy. Health is more than just a right. Health should also be an entrenched value for every person, personal and social, where we are promoting health, promoting, empowering people to take responsibility in collaboration also with improving social determinants of health in terms of maybe basic sanitation, addressing poverty, addressing hunger. All of those things is highlighted now again with COVID in terms of food parcels even, where those three factors should combine. So access to healthcare, personal responsibility, and also the social determinants of health, if we really want a healthy society that we so direly needed in terms of improving the economic situation.
So if I understand you correctly, Prof, what you're saying is that people will do the right thing if they are given those basics. Then they're not focused so much on getting those basics, like getting water, getting proper sanitation, getting food, and a proper place to live in a time like this where you can't social distance, for example. Then they will be able to take the precautions outside of their homes.
Yeah, if you do not have the basic needs fulfilled, it's very difficult. If you do not have access to food and you have to go and queue to get basic food supplies or scratch around for food, you obviously cannot adhere to the rules. But at the same time, we can't wait to be passive recipients of everything. Even if we have very little, we can make do with what we want. Any piece of cloth can be made into a mask or used as a mask. So we can't also say we need the one before we have the other. But clearly, having the social determinants of health correct or in place make it much easier for people to make healthy lifestyle choices. Even if we look at other type of conditions, for example, diabetes, to follow the correct diet for diabetes is easier when you have the means to do so.
Well, Prof, and I think, when we talk about social determinants of health and providing those basics, whose responsibility is that ultimately? Because, yes, you have those who can provide for themselves, and then we have the majority of South Africans, as we've seen, who are battling at the moment, and they really are. So whose responsibility is it to provide them with those basics, those social determinants of health, as you put it?
Well, the primary responsibility, according to our Constitution, will clearly be with government. But there's also social responsibility that we should look at. Bigger companies and even individuals that have the means to assist, whether it's through charity, whether it's through corporate social initiatives, but everyone that can make a meaningful difference can start in your circle of influence. I might not be able to provide 500 people with food, but I might be able to support 5 other people in addition. So you look at your circle of influence in terms of where you can make a difference. So both social value need to, and society need to take responsibility for it, but clearly government is at the ultimate responsibility for it.
So what do you see here as the red flags, or what lessons are we learning when it comes to if and when we finally do implement NHI? What is this teaching us? And granted, it is a very unusual situation that we are dealing with COVID-19 at the moment, but it is going to be, it's going to stay with us forever, the after effects of this. So what are the things we need to take from this in order for that system to work if and when it comes into effect?
There's only 3 things. Firstly is that people should understand that merely having access to care doesn't promise you health. There's still a personal responsibility. And also studies have shown that access to poor health care quality is actually worse for you than no access at all. It was in the Lancet study quite recently. So A, healthcare doesn't equal or health per se. The second thing is we cannot be passive recipients. Even if the government provide or public or private sector provide, you still take and carry responsibility for better choices in terms of diet, exercise, refraining from substances, etc. And the third thing is that we really need to value it as a society, and that starts at home maybe, where parents set an example. If a parent wear a mask, the child will wear a mask. If a parent wash their hands, the child will wash their hands, for example, now. But also going forward, that we each need to take responsibility, and that values need to be taught at home and also at schools.
All right, thanks very much for that, Professor Renata Schoeman. Yes, and answering there, what is our right to health? A personal responsibility plays a big part in that for those who can.